Gender identity disorder, or GID, is the name given to the medical condition in which a person feels that they were born the wrong sex. The symptoms manifest themselves differently depending on the age of the person with the disorder. In children, 4 or more of the following symptoms must be present to be diagnosed with GID. Repeatedly stated desire to be or insistent that he or she is the other sex. In boys, preference for cross-dressing or simulating female attire. In girls, insistence on wearing only stereotypical masculine clothing. Strong and persistent preferences for cross-sex roles in make-believe play or persistent fantasies of being the other sex. Intense desire to participate in the stereotypical games and pastimes of the other sex. Strong preference for playmates of the other sex. The symptoms also differ depending on the sex of the child with the disorder. Symptoms include any of the following. In girls, rejection of urinating in a sitting position, assertion that she has or will grow a penis, assertion that she does not want to grow breasts or menstruate, or marked aversion toward normative feminine clothing. In boys, assertion that his penis or testes are disgusting or will disappear, or assertion that it would be better not to have a penis. Aversion toward rough and tumble play or rejection of male stereotypical toys, games, and activities. In adolescents and adults, the disturbance is manifested by symptoms such as a stated desire to be the other sex, frequent passing as the other sex, desire to live or be treated as the other sex, or the conviction that he or she has the typical feelings and reactions of the other sex. A strong and persistent cross-gendered identification and persistent discomfort with his or her sex or sense of inappropriateness in the gender role of that sex. Persistent request for hormones, surgery, or other procedures to physically alter sexual characteristics to simulate the other sex, or the belief that he or she was born the wrong sex. It is important in diagnosing GID that the disturbance is not occurrent with a physical occurrence of both male and female sexual organs. Another important trait that must be present to diagnose GID is that the disturbance must cause significant distress or impairment in social, occupational, or other important areas of functioning. It is important to note that GID is 100% biological and is attributed to prenatal exposure to unusual hormone levels. The only treatment for GID is through gender reassignment, including surgery and hormone injections. Male to female treatment includes surgical castration, surgical shortening of the vocal cords, breast implants, thyroid cartilage shave, rhinoplasty, electrolysis, speech therapy, and estrogen. Female to male treatment includes construction of an artificial penis from abdominal tissue, fusion of the labia, breast reduction, and androgens. To be transgender means that the person is dressing or living as the opposite sex. This is in no way a choice. GID is 100% biological, and the only treatment is to go through gender reassignment.